According to the Center for Disease Control and Prevention, older people are at a higher risk of becoming severely ill if they catch the deadly novel coronavirus. In most cases, these older adults are also challenged by pre-existing conditions such as heart disease, diabetes, hypertension, and respiratory complications. It is for these reasons that the elderly is a fragile group. An executive director for HelpAge Belize, Everine Bulwer, says she began preparing for the threat a month ago.
We recognize that the older persons are a vulnerable population. We have been cognizant of the situation globally, and hence we have started our preparedness about a month ago. A number of our older persons are affected with non-communicable diseases and the complications, such as they have heart problems, they may have hypertension, the diabetes, quite a number we know. With our diabetics, quite a number of them are amputees. What support they need.
HelpAge Belize manages 2 residential institutions, Sister Cecilia Home in Belize City and the Octava Wait Center in San Ignacio, and 9 activity centers across the country. HelpAge, through caregivers, looks after 72 older folks, 38 at Sister Cecilia and 34 at Octava Wait.
All activity centers will cease activities with effect from Friday of this week. So, in the case of Bemopan, we normally would have activities on Mondays and Thursdays. Thursday will be the last day. We will close, and we will not reopen until after the Easter, and we will have to await the instructions, of course, from those 2 committees I mentioned.
What we have done so far was to provide education to our staff and our clientele. Our older persons we have ensured, and they continue to try, and as many can get the flu vaccine, to get the flu vaccine, all right? The flu shot. Importantly, we are collaborating with the Ministry of Health, both in Belize City and in San Ignacio. We have conducted consultation with the staff, older persons, consultation in a component of infection control, proper hand washing. If anyone is ill, they should not be on duty, they report sick, get the time off. Additionally, we have had consultation and information on what is the coronavirus, the preventative measures. Also, what we have done, we recognize we have a vulnerable population. Visitations have been discontinued. All right, but however, our older persons have that opportunity to be in contact with their loved ones through phone, and in event if anyone reach a stage where, at that dying stage, we're going to facilitate visitation.
With weakened immune systems, these men and women are at a higher risk. An estimated 29,000 older adults live across the country. Belize City has a population of about 7,000 older persons, and it will be the responsibility of their families to protect them from the virus. The National Council of Aging says that the population most impacted by the pandemic are those persons 60 years and over. Approximately 6% of Belize's population is considered older persons, and the population increases by 1,200 every year. Headed by Executive Director Hipolito, the Council has been in dialogue with the voice branches in each district, supporting the dissemination of information for older persons in the community level.
One of the first things that we want families to take seriously is that if you have been ill or you've been in contact with someone that has been ill, to practice social distancing. Because as we can see with the experience internationally, the coronavirus is proving to be deadly for people 60 plus. So we're looking at practicing social distancing. You can keep in contact with your older persons via phone, via text, or putting in place the measures that you need within your home to maintain good hygiene. Even keeping up with the hand washing, the disinfecting, all of these things. And if the older person in your home has an underlying health condition, to ensure that his or her health condition is under control, your diabetes, your hypertension, and that they have the medication that is necessary on hand. We are also stressing that if the older person in your care shows any signs of flu symptoms, to contact the Ministry of Health hotline, because there's no time that we can wait to see what it will develop in with an older person.
Put says that older persons remain a valuable part of the country, and their lives can be protected by the collective and responsible actions of all Belizeans. Reporting for News 5, Hipolito, Novelo.